In this video, we will explore 12 unusual symptoms that can damage the intestine. Knowing these symptoms is very important for you to take steps to prevent the disease from worsening. The intestine has a remarkable ability to heal itself, and with some help, this process can be accelerated. There is a widespread belief that the main cause of intestinal damage is excessive alcohol consumption. Skin problems. Skin health is closely related to intestinal health because the excretion of toxins and the absorption of nutrients in the body take place largely through the intestines. Therefore, skin problems can occur when a deterioration in your intestinal health occurs. For example, skin problems such as acneformation, eczema, itching, redness, and even rosacea may indicate that your intestinal health is unstable. An increase in bad bacteria in the intestines or damage to the intestinal lining can negatively affect your skin health. It is also possible that toxins accumulated in the intestines can damage your skin. Therefore, it is important to take care of your intestinal health in order to have a healthy skin. Meeting with a dermatologist or gastroenterologist who specializes in this topic can help you understand the root cause of your skin problems and determine appropriate treatment methods. You can also improve your skin health by reviewing your eating habits and including foods that support gut health in your diet, such as probiotics, prebiotics. Remember that skin problems usually should not be handled alone, and underlying health problems should also be evaluated. Constant fatigue. Sudden and constantly felt fatigue is usually associated with low energy levels of your body or the need for rest, but the constant feeling of tiredness may indicate that your gut health may also have been affected. Intestinal health is responsible for the absorption of nutrients and a balanced intake of nutrients that provide energy to the body. If there is a problem with your intestines, the absorption of nutrients may be disrupted and your body may not get enough energy. As a result, you may feel tired all the time. In addition, if your intestinal health deteriorates, conditions such as inflammation and toxin accumulation in the body can also affect your energy levels. If you are constantly feeling tired despite getting enough rest, it is important to review your intestinal health. Improving your eating habits, eating fiber-rich foods to create a healthy intestinal flora and facilitate digestion, taking probiotic supplements, and paying attention to stress management can help reduce your feeling of fatigue. However, it is important not to ignore the serious health problems underlying complaints, such as constant fatigue, and to consult a health professional. Abdominal pain and gas. Abdominal pain and gas are often considered a symptom of digestive system problems and can give important clues about the state of your intestinal health. Severe abdominal pain, often a blockage in the intestines, can be a sign of serious health problems such as irritable bowel syndrome, IBS, celiac disease, or inflammatory bowel disease. This type of pain usually increases after a certain meal or in stressful situations. Gas can form as a result of air accumulated in the intestines or fermentation and can cause bloating, a feeling of discomfort, and even abdominal pain. It usually occurs due to gas, the consumption of fibrous foods, fast eating habits, bacterial imbalances in the intestines, or digestive problems. Besides abdominal pain and gas, another important sign that affects your intestinal health is stool. Changes in stool may indicate digestive problems or intestinal infections. For example, symptoms such as frequent diarrhea or constipation, abnormal changes in the color, consistency, or odor of feces should be taken into account. Although bad breath is often associated with oral hygiene problems, a persistent and abnormal odor may indicate that your intestinal health may be impaired. Irregularities in your intestinal health and an increase in bad bacteria can cause bad breath. In particular, constant bad breath may be associated with acids from the stomach, causing odor in the mouth, which can be caused by digestive problems such as reflux, gastritis. Bad breath problems can usually be alleviated by methods such as reviewing eating habits, consuming fiber-rich foods, drinking enough water, and probiotic supplements. In addition, paying attention to oral hygiene and regular dental care can also reduce bad breath. But if you are experiencing persistent and serious bad breath problems, it is important to consult a healthcare professional because these symptoms can often be a sign of serious digestive system disorders or metabolic problems. With early diagnosis and proper treatment, bad breath problems can usually be managed and serious health problems can be prevented. Mental health problems. It is now scientifically supported, decently, that there is an important link between intestinal health and mental health. The interaction of the gut microbiota and the gut-brain axis greatly affects mood, behavior, and overall mental health. If your intestinal health is impaired, mental health problems may also occur. Anxiety and depression in particular have been closely associated with intestinal health problems. Conditions such as inflammation in the intestines, disruption of the intestinal membrane, insufficient absorption of nutrients can lead to changes in the chemical balance in the brain and mental health problems. In addition, toxins and bad bacteria that accumulate in the intestines reaching the brain can also contribute to mental health problems. If you have mental health problems and you are also having problems with your intestinal health, it is important to consider the relationship between this condition deck. You can also positively affect your mental health by improving your eating habits, consuming foods that facilitate digestion, applying stress management techniques, and taking supplements that support your intestinal health. However, one thing to remember is that mental health problems are a serious issue, and it is important to get professional help. Meeting with a psychologist or psychiatrist can help to make the correct diagnosis and determine an effective treatment plan. Taking your gut health and mental health together can contribute to improving your overall health. Severe appetite changes. Abnormally increased or decreased appetite, feeling hungry or feeling full may indicate that your intestinal health is unstable. It plays an important role in intestinal health, absorption of nutrients, digestion, and controlling the body's energy balance. Therefore, when a deterioration in your intestinal health occurs, you may experience significant changes in your appetite. For example, a sudden increase in appetite may indicate that your metabolism is unbalanced or that your body's needs for nutrients are unbalanced. Similarly, a sudden loss of appetite or a constant feeling of fullness may signal that digestive system problems or your eating habits need to be revised. To improve your intestinal health and balance appetite changes, it is important to adopt healthy eating habits, consume fiber-rich foods, drink enough water, and exercise regularly. In addition, potential health problems such as food intolerances or digestive system diseases can also cause appetite changes, so it may be useful to consult a specialist health professional. Changes in appetite are one of the important signals that your body gives you about your intestinal health, and it is important to act consciously about your health status, taking into account these symptoms. Immune problems. There is a strong relationship between intestinal health and the immune system, DC. The intestines are one of the first points where your body is exposed to the outside world, and the immune system is largely regulated through the lymphoid tissues located here and the intestinal microbiota. If your intestinal health deteriorates, your immune system may also be negatively affected. Immune problems usually occur as constant illness, decreased resistance to infections, and a generally weak immune system. A weak immune system can be a sign of more serious underlying health problems, and it is important to treat it with early detection. Strengthening your immune system will help improve your overall health and protect you from diseases. Weight changes. Sudden weight gain or loss may be associated with metabolic problems, hormonal imbalances, and nutritional disorders. This may also indicate that your intestinal health is being affected. Poor digestion. Digestive problems such as poor digestion of food, indigestion, heartburn, and reflux can be indicators that your intestinal health is unstable. Constipation or diarrhea. Having a constant constipation problem, or conversely, having constant episodes of diarrhea, is an indicator that your intestinal health is unstable. Irregularities in bowel movements are a sign of digestive system problems. Poor digestion. Digestive problems such as poor digestion of food, indigestion, heartburn and reflux can be indicators that your intestinal health is unstable. Food sensitivities. Sensitivity or intolerance to certain foods may indicate that the intestines are reacting to these foods. In this case, a special diet related to the consumption of certain foods may be required. If you like the video, don't forget to like it. Subscribe for more such content. Wishing you a healthy day. See you in the next video.